Hi guys, my name is Heidi and I'm going to show you how to insert a Foley catheter today. Before anything, you want to make sure that the patient has orders in their chart for the insertion, which they do, and then you're going to want to gather your supplies, which we have here. Our patient today is Tran Nguyen, and they are getting a Foley catheter for urinary retention. Now that I have all my things, I'm going to go to the patient's room, check for any isolation precautions or anything posted outside the room, which there are not. And I'm gonna knock and enter the room. Behind me, I'm gonna make sure I close the door or the curtain for privacy. So you come in, knock, knock. Hi, Tran, my name's Heidi. I'm gonna be doing a Foley catheter on you today, okay? All right, the patient is aware of what we're gonna be doing. Can you please verify first, last name, and date of birth? Patient's name is Tran Nguyen, birth date is 9999. All right, Tran, thank you so much. So I just want to make sure that you don't have any allergies. You want to make sure the patient doesn't have any allergies, especially to the things you'll be using. Patient does not have any allergies, so we are good to go on that part. And now that we've done that, we're going to make sure that we explain the procedure to the patient. So Tran, I'm going to be inserting a Foley catheter for you today. You have urinary retention, which means you are not peeing, and so the doctor would like to insert the catheter to get the urine out of your bladder. Okay, so patient consents to the insertion of the Foley catheter. So what we're going to do next is we are going to make sure that the bed is raised, which it already is to save time. So we raise the bed. We're going to make sure lighting is good, everything's ergonomically correct. So everything is ergonomically correct. Next, I'm going to do some hand hygiene and don some gloves. I'm going to do that. And before anything, I'm going to wipe the surface here, just so that my sterile area, it has something clean to sit on. So I'm going to wipe with the wipes here, make sure it dries, and then I'm going to leave my stuff here. You don't want to don new gloves, hygiene and new gloves after using the wipes. So I'm going to do that, sanitize new gloves, and next we are going to prepare the patient for the insertion. So just going to let her know, we're going to pull your blanket back, Tran, and we are going to insert the catheter. I'm going to have to lift up your gown. Okay, great. So we're going to lift up the gown, and we're going to get the patient in position. So we're just going to put them in a butterfly position, which means you're going to bend their legs at the knee, and they'll spread their legs. So this is a good position for the insertion. So now that we're done with that, I am going to do some peri-care for the patient. These are going to be my peri-care wipes. So basically you're going to want to start from the side away for the legs, and you're going to just wipe away. We're going to toss every time we wipe, one wipe per site. So we toss this just to save time. I'm just going to keep this. Same thing, wipe away, toss. You're going to wipe each labia, toss, toss, and down the middle, and toss. So we're going to get rid of that. And then now that we are done with that, I'm going to take off my gloves and we're going to get ready to do the procedure. So now that I've done that, I'm going to do some more hand sanitizing, and I am going to open up my supplies. So I have an extra pair of gloves just in case, and then my securement device, which is already on the patient, so we're just going to pretend that I put that on later. And then here is my kit. I am going to leave this here for any trash that I acquire during the procedure. You can leave that at the patient's feet. And then we are going to open the sterile field. This is going to go under the patient, shiny side down. This is just to catch any fluids that come out in case while we're doing the insertion. Okay. All right, so we have that, and we are going to open this up. You'll see we have some gloves here. Making sure to only touch the 1 inch around. We're gonna pull this. All right, so now we have our sterile field here. My gloves are here. You wanna make sure you don't turn your back on this. So we're gonna put our gloves on. Same thing, just 1 inch border. That's all you have to touch for any of this. So we are going to first put on one glove. That just broke, but for time's sake, I would change these because that's breaking sterile field. And then we're gonna put this one on. All right, so we are done with that. Do not ever put your hands below the sterile field. That is breaking sterility. So if you get stuff on the floor, who cares? All right, so we're not going to use this. And we have some iodine swabs for the patient to make sure that they are nice and clean. We have sterile saline to go into the balloon for the catheter, and we have our lube. I'm not going to use this. I'm going to go ahead and attach this syringe to the catheter where it will inflate the balloon ahead of time to save myself time and make it a little less difficult to do everything. And then I'm going to put the lube in the box. You can put lube on the urethra and the tip of the catheter. It just makes things a little easier. We won't really need this. So we're going to go ahead and we're going to take our sterile field and place it between the patient's legs, making sure to keep the field sterile. All right, so here we go. So now that we are here, what we're going to do is we're going to clean the labia and the urethra. And we are going to do that with these swabs. And these have iodine on them. There are 3, so 1 per labia. So what I'm going to do is I'm going to take these out, throw that away, and with my non-dominant hand, I am going to hold the labia apart. Tran, I'm going to pull your labia apart to do some cleaning, okay? Okay, great. So I'm going to pull the labia apart. One side of the labia clean, the other side, and then the last swab you're going to do right down the middle, which is the most important part because that's where the catheter is going, right down the middle. So now that we have that, we're going to keep our hand here because now this is no longer sterile. This is our only sterile hand. So we are going to go ahead and we are going to insert our catheter, being careful not to drop it out of the sterile field. It has a sheath on it, so be careful. It's a little tricky sometimes. All right, so we're still in the sterile field. We have already placed some lube on the urethra prior, and we're dipping the lube on the patient, on the catheter. So with the labia still held open, we are going to insert the catheter into the urethra, advancing it until we see the urinary flash. Once you see that, you're going to advance it 2 more inches, and then you are going to hold that now with your non-dominant hand to keep it in place until you have filled up the balloon with the saline from the syringe. We're going to insert that. And we're going to pull back just to see if there's any resistance, which there is. That means the balloon is inflated and we are ready to remove our sterile field and continue with the last step. So now that the balloon is inflated, I can let that go and I'm no longer sterile. I'm going to put all my stuff here and we are going to secure our catheter to the leg just to make sure nothing's pulling or it doesn't get yanked out. This again was here already, but for time's sake, I put that there. And you're going to hold the Foley here. Make sure it's not pulling too tight or not too loose. And then we're going to take our bag and we are going to make sure that it is below the bladder and we are going to hang it on the bed. So that is there, and we are going to remove all of our things now. This could be thrown away per protocol, so we're going to throw this away. So we're done with that. So now I'm going to take off gloves, do hand hygiene, and do peri-care again. For time's sake, I'm just going to pretend that I changed my gloves and cleaned my hands. We're going to do the peri-care again. Wipe. We're tossing out after every wipe, and we're wiping down labia, both sides, tossing out after every wipe, and down the middle. Make sure we're getting excess iodine and anything off. So patient is nice and clean. We're going to take off our gloves, and then we are going to do some hand sanitizing, and we are going to get the patient back into position. Make sure that they are comfortable, no pain. Patient is comfortable, has no pain. And we're going to lower and lock the bed, make sure that she is in a good spot and that she feels comfortable. And then we're going to go and document. And make sure that we have a call-ate and that they don't need anything. And that's how you insert a Foley catheter.